In this video, I'm going to demonstrate some of the maneuvers and techniques involved in narrowing of the nasal tip. Refinement of the tip involves evaluating and adjusting the nasal cartilages and taking the skin into account. If you look at this diagram, you notice the blue-green tip cartilages known as the lower lateral cartilages. This is from the profile view. If you look at it from the front view, again, you can see the left and right that come together. In addition to some of the other structures, most importantly skin as well, the nasal tip has its unique shape. What I'm doing here is you can visualize again the left and the right lower lateral cartilage. I'm grabbing the left lower lateral cartilage, which I've measured previously in the previous video series, and I'm making an incision called a cephalic trim. This is very important in narrowing the nasal tip, but what's even more important is leaving enough cartilage for support. And you can see the incision that I've made here. You do not want to remove the entire cartilage, and you do not want to remove any more than you need to. And you have to make sure that you leave at least 6 to 8 millimeters of cartilage behind to support the tip and the nostrils. What I'm now doing is, after I've made the incision, I'm actually cutting that piece of cartilage away. And like I've mentioned before, we save everything because I may recycle it and use it as a graft in a different part of the procedure. So now the left lower lateral cartilage has been trimmed and narrowed appropriately. I'm going to repeat the procedure on the contralateral side, which is the right side. Again, grabbing the cartilage, making the incision in the previously determined location, and leaving enough cartilage for support. One of the biggest mistakes of previous plastic surgeons in the old days, and some still making the same mistakes today, is removing entirely too much cartilage. Worse yet, some surgeons remove this entire cartilage from the dome outwards. And while initially, with the swelling, the nose may look fantastic, a few months to a few years later, the tip gets deformed, the nostrils get pinched, bossae or nubbings can form, and the nose just becomes extremely operated looking. So conservation of proper cartilage and architecture of the nose is extremely important. While trimming is sometimes necessary like this, reshaping the cartilages with sutures, which I will demonstrate in a subsequent video, to create a better tip definition will be even more important. And you can see now the red portion of the cartilage that has been removed and the green-blue part that has been left behind. These are known as cephalic trims. Now you can see that the cartilages are actually separate right now, and again, using sutures I will bring them together and create a nice uniform tip, which we will demonstrate in another video series coming up.